Hi everyone, it's me, Fran Drescher, bringing you Corona Care for You by Cancer Schmancer. Thank you for coming once again. We have a very interesting speaker, somebody who I personally think is absolutely great, and I think you're going to love her too. We've had the privilege of having her speak at some of the Cancer Schmancer Masterclass Health Summits. And she's a rheumatologist. She's an integrative medical doctor. She's an expert on environmental impact and environmental medicine. So please give a warm welcome to Aly Cohen. Thank you for being here. How are you, doctor?
Good. Thank you, Fran. So nice to be here with you guys and your audience.
Well, you look wonderful. So tell us, what are your thoughts on everything that's happening? How are you dealing with your patients? Do you currently have anybody that's dealing with the coronavirus?
Yeah, well, I'm in New Jersey, so
Oh,
a lot of this is hitting home into New York, New Jersey area. I trained in New York, so a lot of my colleagues are out there really on the front lines in the Bronx and
my
Manhattan.
sister is a nurse at NYU.
Yeah, it's my college roommate is the head of infectious disease at one of the hospitals. So it's interesting to get that perspective, and then to see my neighbors and my patients and all of the quarantining issues and sometimes complaints about the quarantine. But it's a new time, and we're all trying to figure it out. And so we have to be kind of kind to each other and the way we respond, because this is really new information and new stuff going on.
Well, what do you think is something that we should all be mindful of in terms of self-care and using this as an opportunity to maybe change some things so that we can better uh, weather this storm?
So, it's interesting. I think a lot of fear comes from not being in control, and I'm used to taking care of a lot of autoimmune disease patients, or any patients really for that matter, where a lot of the fear comes from the lack of control. And I always look at the serenity prayer, for instance, as kind of something to follow, in the sense that in this situation, as with any hardship, any ailment, we want to think about what we can control. And control gives us a little bit more of an ability to handle fear. So when I'm talking to my patients and friends and family, I really like to kind of hone in on what I call low-hanging fruit. The things that we all can do, the things that we can do right now, and we could do even pre-COVID and post-COVID, which is really thinking about how to get the human body back to where it should be, from an evolutionary perspective, and from an environmental health perspective. What can we do to get the human body working at its best and to thrive? Well, there's really important things to think about that we can all do. Number one, we need to get the right amount of sleep. Sleep is quality and quantity of sleep. Because
I've been hearing that a lot from the doctors. It
and
seems to be
yeah,
across the board a very important consideration.
and we now know that having not enough sleep actually increases inflammation, which I'm going to get to in a minute. But we have that as a predisposing issue for increased inflammation and risk for chronic diseases. We have certainly food quality, processed food, junk food that we really should try, as difficult as it may be. In quarantine, we really want to think about eating clean, eating well, less pesticides, less processed food chemicals, which in their own right cause a big degree of
Well,
inflammation.
it's interesting that you say as hard as it is, because truth be told, once you start eating healthier foods, and when I say healthier, I mean foods that are organic, that aren't heavily processed. It doesn't mean that you can't have a delicious piece of organic dark chocolate, or even, a piece of cake or a piece of pizza, or, but whatever it is that you love, uh, ice cream, just make sure that it's pristine and it's not full of antibiotics and hormones and pesticides and herbicides and, all kinds of chemicals and flavorings. Just make sure it's made out of wholesome ingredients that are organic, that, can't hurt you.
Right.
And so if I put something in my mouth now that's heavily processed with corn syrup sweeteners and GMOs and all this stuff, I don't feel well from it because my body is used
Right.
to, eating real food, not fake toy food.
Right.
And so I think that once you commit to it, because you know how much better your body is going to perform as a result, it's not hard. And you can still eat. People somehow think that to eat, you know, pristinely grown food means you can never have anything that you love anymore. But everything is available, but healthy version of it, not
And
the
and
cheap
inexpensive.
compromised.
Sure. And I think when you think about cost, also has to come into all these conversations. Um, Frozen organic foods are readily available, big box stores. So we now have a market that's supporting this organic movement, or at least cleaner eating.
Oh
Um,
yeah, they have organic at Costco and Walmart
yeah,
now. And
absolutely. So it's a matter of, depending on where you are on the spectrum of change, right? Some people have never seen a vegetable in their life, and some people, are even more extreme and to the opposite direction. But I think, giving your body good, clean food, trying to reduce the levels of inflammation in our body through clean eating, clean drinking water, which is a big area that I like to talk about. Um, Personal care products, as you talk a lot about with, in Cancer Schmancer, we really want to lower all of that influx of chemicals that do get into the human body. Certain furniture has chemicals like flame retardant chemicals, and there's ways to, get those
I
out.
just bought an organic bed, and in order for me to not have the cover that does have flame retardant on it, I had
Yeah,
to get a doctor's note
really.
just to not, and maybe it's the state of California, but I
Yeah.
had to get a doctor's note so that they could provide me with my organic bed without a flame retardant covering.
You know why? It's because it doesn't have materials that are potentially naturally flame retardant, like wool. Wool batting, certain materials, if that organic bed was made with those materials, you might not have needed that,
That's true.
because there has to be some oversight as to, with the flame retardant issue, which is a whole nother story. But I think that may be the issue.
I'm sure you know, but I don't know if our viewers know, that American women's breast milk has the highest percentage of flame retardant in it from any other woman on the planet. We have been sold a bill of goods by big business chemical
Yeah.
companies, and it's slowly but surely affecting and compromising our health because it is so pervasive in our daily life. It is everywhere. It's in the food we eat, the fabrics we wear, the personal care items that we use, our toothpaste, the things we garden with. I mean, it's way, way, way too much and completely unnecessary.
Yeah. And that's the low hanging fruit, is how do we pick off each one of these categories of exposure routes, through skin, through air fresheners that are synthetic, carpeting, backing, any number, like I said, personal care products, textiles. We have to really think about whether we need these chemicals, whether we're aware of these chemicals, and really lowering them, because it plays out right now. We're seeing 90% of the, hospitalizations, numbers by the CDC, are related to comorbidities and to chronic health conditions. And we know these chronic health conditions are contributed by inflammation that comes from our environment. Not entirely, but a good deal of it. And so,
The majority of it,
yeah, right,
over 90% of
right.
it.
Right. Well, the chemicals lead to, and again, each one has their specific science behind them, but we know in general that a lot of these man-made post-World War II chemicals that are synthetic are in our blood, in our urine, in our breast milk, as you mentioned. And we really need to think about how we know that they're affecting chronic conditions such as, endocrine disruptors, right? That class of chemicals is affecting thyroid conditions. I mean, who doesn't know someone on a thyroid medication at this age, even at a younger age than 50 or so? I'm seeing teenagers on thyroid medication. There's high rates of thyroid papillary cancers that are younger, which never used to be the case. So we want to think about what we're doing to ourselves, what we're holding on to, and how that plays into chronic disease. Because as I mentioned, the chronic diseases are priming the inflammatory process and may make us more vulnerable to any number of insults, including infections like COVID. So we have to really think about that moving forward.
Do you subscribe to any of your patients as a rheumatologist, LDN, low dose naltrexone?
Yeah, not an overwhelming amount. We don't really know how it works. A lot of people don't know that naltrexone is kind of the antidote for heroin overdoses in a much higher dose. And what you're talking about, as you mentioned, was low dose naltrexone.
Microdosing.
Yeah, and so it's related to these new receptors, which have to do with sort of this feel-good set of receptors that are throughout the body. No one really knows.
Endorphins, like?
I would say not. I don't want to
No?
grossly categorize, but these
Okay.
new receptors that have to do with the pain connections in the body and how we perceive pain. So it is used in quite a bit for chronic pain conditions. Certainly in rheumatoid arthritis, there's some decent evidence that it is helpful. And has low risk, generally speaking. But again, all these things need to be worked out with doctors that are managing those specific cases. But it's an interesting drug that seems to be helping. I have patients that are on it that seem to be doing pretty well.
If you had to give your patients or our viewers what would be like, in addition to a conscious effort to reduce all of the toxic and carcinogenic chemicals in your life. And we have a very progressive program at Cancer Schmancer called Detox Your Home. It's like, go to cancerschmancer.org and learn how to do that. It's never too late, and now is the best time possible. But besides that, if you had to say, in addition to that, take these couple of things like right now and start supporting your body, what would that be?
Nature. Take nature if it came in a bottle. Okay. I recommend everyone go outside, not near anybody, social distancing, but definitely, I'm working outside for a half hour every day. I think people don't realize the power that just seeing green stuff matters. I would also say, in terms of what you take, well, I'm a big fan of what you don't take, mostly in terms of, again, environmental, diet, nutrition, clean drinking water. When it comes to nutrition, our food is lacking in quite a bit of nutrients that our body needs, our fertilizer for humans to thrive, really. So I do actually recommend to all my patients that they should be on a clean multivitamin. Clean meaning no colors, no additives, no preservatives. It's third-party checked for quantity of what it says it has in it, because that can be, we're kind of unregulated when it comes to supplements in this country. So third-party tested for quality and quantity.
What should it have in there? See, magnesium,
all of it. It
what?
should have zinc. 25 milligrams is a good multi. That's a very baseline level. We need zinc. Zinc's very important, especially with COVID right now.
I think I'm taking like 40 a day.
You have to be careful because so many people, I'm not saying that's a bad thing, but so many people are just taking bottles and go. It's like, it's insane. So I'm trying to.
Good.
Well, you got to walk people off of a ledge because, with all the fear that's going on and all of now the inundation of information, even supplement sales and, health and wellness groups, you have to be very careful because they're taking.
How much C would you suggest people take?
I think vitamin C, probably in the range of 1,000 a day. It's an antioxidant. I'm always thinking side effect risks or comorbidity issues. There's not much with C. It's an antioxidant. Zinc works in terms of being sort of an anti-viral type of supplement. One really good one to think about is iodine that we do not get in our diet anymore. It used to be infused into our bread in our salts, but no one uses salt anymore that has iodine. We use sea salt, right? Because that's touted as more healthy. The problem is that there's no iodine in there. The way iodine works is it actually kind of sits in the thyroid gland and in the spots where environmental chemicals will get into unless there's iodine. So it kind of holds the spot. Chemicals like perchlorate, nitrate, cythiophenate. So, we want to think about environmental chemicals if we can keep them away by keeping our bodies nutrient sufficient, by getting just enough iodine, not too much, but just enough in a multi, and maybe from diet. That is the way to handle it.
Seaweed has a lot of iodine in it, doesn't it?
Yeah. Yeah, and they all vary. Dolce, what are the other ones? Nori, they all have variable levels. So when I have a patient who needs iodine, because again, I'm testing for these levels so that I can adequately and appropriately supply them or recommend them. You really want to do that because people do go nutballs and they just take everything. And so you want to measure what you're trying to achieve. So for instance, even vitamin D, we hear a lot about D right now. Vitamin D is something that we should have a level that's normal or high normal based on the lab normals. And that should have been kind of ongoing, not just for COVID.
Right.
You need vitamin D for a variety of physiologic functions, including cancer prevention, muscle function, brain function, in terms of Alzheimer's protocols. I mean, you want to normalize or high normalize your D. So again, if you get a good multi and you have your vitamins tested, like a D level from a primary, you can start to take the things that are necessary for human health. And I think that's the way to go. You don't want to take 100 things if you don't need them, if they're not appropriate for you and your condition.
I've been hearing a lot about a word called, I think it's liposomal.
Yeah.
Can you explain that to me and our viewers? Because
Sure.
I'm not exactly sure what liposomal vitamin C. I don't understand what that is.
Yeah, liposomal means, lipo means fat. So liposomal means that vitamin has been dissolved in a substance that's fatty and can actually absorb into the body perhaps a little bit better. Some companies use it for marketing. Some people legitimately make liposomal compounds. But it's really about absorption, and it's about how do you.
So do you recommend that, rather than like having your vitamins with juice, it's better to have it with something that has some fat content to it so the body can.
Yeah, most vitamins and most supplements, not all, but really should be with food. And some of them, like fatty vitamins, like vitamin D is oily if you ever touch it. There are 4 fatty vitamins, A, E, D, and K, and those 4 vitamins are oily. And they live in our body, we store them. And so when you absorb them with foods, particularly fats, because they're fats, you tend to absorb them a little bit more efficiently. Whereas water-soluble vitamins like the B's and the C's, don't necessarily have to be absorbed with a fatty meal. But I just say make life easy and just take it all with food. And then you at least have a better shot of absorbing your vitamins than you would if they were taken on an empty stomach. Again,
that's why I tend to take things that are sublingual or on the tongue, because it's more directly absorbed than if it has to go through your whole digestive system. Exactly. Is that something, if you could find something that you like and it just sprays on the tongue or goes under the tongue, is that a better way to receive it, a better delivery system?
It's a great question, Fran, because what happens with the vitamin D, I'll just use that as an example. Vitamin D sometimes doesn't get absorbed through the 24 feet of bowel that we all have. And just like other vitamins, or maybe even certain medications don't get absorbed efficiently. I have patients that no matter how much vitamin D as a pill they take, their D levels don't go anywhere. So I move them to sublingual D, which are drops. They're oily drops. I give them actually my own dropper from a pharmacy because I don't like the caps that a lot of them come with, which are variable in size, and it changes their D levels. So I give them just a simple 30-cent dropper, and they do it under the tongue. They drop them under the tongue, but you have to walk around for maybe a couple minutes, because that's the absorption process. As soon as you swallow it, It's worthless. So, but that's a great question, because anytime, and there is variability, every human has variability in their absorption of the gut due to stress, due to other medications, due to bowel disease, diverticulitis, IBS, whatever it may be, microbiome issues, we vary from person to person. But the one way to equalize that issue is if you do a sublingual for the nutrients that you do need. And again, I go back to the testing is valuable.
Wonderful. This is great information. And, this, I think, has become an opportunity for us to just examine our lives and see where we can help ourselves to be healthier and be less compromised and be more mindful of what we're bringing into the home, what we're putting on our body, in our body, and around us.
This is a wonderful program you're putting together, because
Thank you.
yeah, it's great.
Yeah, well, that's what we do. We try and present alternative points of views to our members around the world. And thanks to medical doctors like yourself, who are really looking at the whole body and looking at how we exist in the current environment that we live and how that's impacting our health on a daily basis is so important. And it's so 21st century, and it's so timely that we are really being forced into looking at this for those that are a little slow on the take and still embracing some of the more toxic indulgences from the 20th century. I think now more than ever, it's time to bite the bullet, let those things go, and everything old is new again. Start bringing some more wholesomeness and pristine everything into your life, and you will see a difference very quickly. The human body is amazing how it responds to clean, organic, eco-friendly products. It's just incredible, and I can't thank you enough for all you do on behalf of the greater good. You're just a blessing and a great doctor.
Thank you so much, Fran. It was my pleasure. I enjoyed it.
Thank you so much for tuning in. Please keep checking with cancerschmancer.org, because we will continue to post interviews like this and many more to come. And we hope that in some small way, it's going to ease your mind, empower you, educate you, and allay your fears in a time of confusion, and maybe help you to set forth on a new trajectory that will turn these lemons into lemonade and set you in a direction where the whole paradigm shifts for all of us. And we all come out of this with a new point of view and maybe a healthier constitution. So be well, God bless, and thank you again. Our prayers are for you always. Hi everyone, it's me, Fran Drescher. Well, I hope you enjoyed Corona Care for You, and if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events, so it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Corona Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.